Hi everyone. Um, this is your PowerPoint presentation on Module 7, which is about engagement and forming relationships. I really like this module because I feel like it kind of ties things together. We've learned a lot so far in this class about the strengths perspective, about systems theory, and a lot of those things are kind of abstract before we really start to apply them. You've taken classes in the past, interviewing class, which we're going to talk about when it comes to engagement, and you're taking your internship practicum and seminar now. So this is going to tie together the things that you have already learned, the things that you're learning this semester, the things that hopefully you're seeing in the field and practicing in the field. I really like the way that this chapter started. So you actually had to read 2 chapters for this week, which I know feels like a lot of information, but because I think it's really connected to many of the things that we've already been talking about and some of the things you've already learned, I'm hoping that the information won't be too overwhelming for you. But obviously, if you have questions, reach out to me, post them in the Q&A forum, and I will answer them as quickly as possible. But I like the way that chapter 7 started. It opened up by saying that relationships between social workers and clients are fundamentally relationships between human beings. Whether working with an individual or a whole community system, social workers are connecting with other humans to achieve mutual purposes. The relationship formed by social workers and clients differ from social relationships. Although they are friendly, social workers and clients are not friends. Although these relationships are genuine, they have designated purposes and defined endings. So this is important. These things are important to keep in mind when we start to talk about engagement, which is really kind of the basis of everything that we've been learning about and talking about, which is forming a human connection with another person and with the goal of helping them. Okay, so when developed as a partnership, the social worker-client relationship itself becomes an empowering resource for change. To achieve this partnership, workers need a conceptual understanding of the relationship, effective communication and interpersonal skills, ability to relate cross-culturally, and social work ethics and values to guide transactions. So again, this is just reinforcing the things that we've been talking about, right? So we understand that if we're going to empower a client, we need to form a collaborative relationship. We can't come in and be the expert on somebody else's life. We need to be able to communicate with people whose cultures are different than ours, or who are similar or different to us in many different ways. And we need to think about the code of ethics, which you all have read at this point, and the social work values, so that allows us to guide our communication and our relationships with our clients. Okay, so we have some food for thought here. I would like for you to try to answer these questions as you read through the chapter and the rest of the information in the module. So what do the clients bring? What does that mean? What is the problem with the social worker as expert? What does it mean to meet the client where they're at? How is a client-worker relationship different from a friendship? And what's the difference between doing with and doing for? Because all of these things, if you can answer all of these questions, then you should be well on your way to being a social worker coming from an empowerment perspective. Okay, so some steps to actually make this happen. So your reading didn't cover this so explicitly, but I think that we can kind of take what was in the chapters and look at it in a more concrete way, right? So steps to practicing from an empowerment perspective, when we want to engage with clients, the first step is to acknowledge our own feelings. Hopefully you've heard me say that in your 201 class, but it always starts with self-awareness, right? We have to be aware of our own feelings, aware of our own belief system, and aware of our judgments so that we can put them aside and really put ourselves in the client's shoes. So acknowledging our feelings and reflecting on our own belief system are the first things you're going to do. Meet the client where they're at. So this doesn't mean if the client is at Panera, you go to Panera, although it could mean that. But it really means looking at what the client is bringing with them, right? So what strengths are available, like what strengths do they have? What resources are available to them? What are the challenges they're experiencing? what is their emotional level at right now? So reflecting their feelings, right, and validating their feelings. It's really about understanding where the client is coming from and approaching them with empathy and respect. Acknowledging that they're the expert on their situation. We're talking about engagement here, so this is a client that you've just met. So if you come in and try to, diagnose them or assess them in 30 seconds or less, or tell them exactly what they need to do, they're gonna feel either completely shut off, or you're gonna enter into a relationship of dependence rather than a relationship of empowerment, right? So we don't want the goal of our interaction with the client is for them to be able to move forward in their lives without us, right? And for them to feel some control and ownership over their life so that they can improve their situation, not for them to feel like they are dependent on us for the rest of their life. So we start that by acknowledging that they're the expert on their life, and that is how we enter into a collaborative relationship, by treating the client with respect and acknowledging that they're the expert on their life. Okay, so we're going to walk through some different scenarios here about how you would begin the engagement process. So very often we begin the process with a telephone call. Obviously not always. Some of you are interning in places where the clients are there all the time, like a residential facility or perhaps in an after-school program. You just show up to work and your clients are there. Or a day program, right? So, but if you were taking on a new client that you haven't met before, whether they're coming to you or you're going to them, most often it starts with telephone contact. So what do we do here when we have to make a phone call to a client who we've never met before? The first thing you want to do is identify yourself. Identify where you're calling from and what is the purpose of your call. So hi, my name is Caitlin. I am an intern at the Well Life Network, and I am calling to try to set up a meeting with you for an intake for this new program that we've started, right? So be clear and concise. You don't want to talk for 5 minutes straight before the client has an opportunity to respond. If the client doesn't know who you are, they're probably going to hang up. How many people screen their calls nowadays, right? Reduce the power differential is the next step. So we want, does the client have a choice to meet with you? That's something you want to consider. Have they been mandated? Are they required to come? Does the client have options for an appointment time? And why do you think this is important? So are you available only on Tuesdays and Thursdays? If that's the case, then you want to say to the client, I have some free time available next week on Tuesday or Thursday. Which of those days would be a better fit for you? I'm free between 9 a.m. and 5 p.m. What you don't want to say is, can you tell me what day is good for you next week? If you're only there 2 days a week, you want to put that out there right away so that the client doesn't feel disempowered when you say, what day do you want to come in next week? And they say Wednesday, and you say, oh, actually, I'm not here on Wednesday. I can only do Tuesday or Thursday. Let them know that off the bat. And so because you want to let them know things like that, it's a good idea to make sure that you're aware of your own schedule before you pick up the phone. Prepare a little bit for the phone call. But who are you? Where are you calling from? What is the purpose? Being mindful of whether or not they have a choice to meet with you and putting that out there, and what options they have for a time to meet with you. Okay, those things can reduce the power differential. During your initial meeting, you want to make sure you introduce yourself and your purpose. So I'm Caitlin, I am the intern here, and I'm going to be collecting some information from you today so that we can determine whether or not you're eligible for this program. You want to greet the client using formal, respectful language, so Mr., Mrs., Miss, and ask them what they want to be called, right? So, hi, Mrs. Parjak. Is it okay if I call you Mrs. Parjak, or would you prefer that I call you Caitlin? Am I pronouncing your name correctly? Making sure that this is a sign of respect, right? You want to make sure you're communicating clearly and in a method that the client understands. This can be challenging when you have things like language barriers. If you do have a language barrier and you have access to an interpreter, or you have another worker at your agency that speaks that language, see if you can get the client services in the language that they understand. If not, then we have to be creative. And there's apps now that you can use for translation purposes. You might be able to translate some of your paperwork through an app beforehand into the correct language. What you want to do, though, if that's the case, is you want to make sure you translate it into that language and then also translate it back into English, because sometimes things get very lost in translation, and we can talk about this more if anybody has questions. This is a good thing to bring up in the 201 class. But you also don't want to use really expensive fancy words, right? And that doesn't mean we're dumbing it down, right? We just want to make sure that we're communicating in a way that makes sense and that's not going to be abstract, or that the client isn't going to be confused about what we're saying. And we also want to make sure we're not talking too fast, which I have a tendency to do myself. You want to take your time. You want to pay attention to the client's verbal and nonverbal cues. And when in doubt, check out. Do you have any questions? Is that clear? Does that make sense? Okay. So these are all things you want to do during your initial meeting. Physical arrangements. So this is another thing that you want to pay attention to. If you're meeting the client in their home or if you're meeting the client in the office, what does the situation look like? Where are you going to sit? Where might the client sit? Are there multiple clients? Are you going to meet with a family? So paying attention to the physical arrangements. If you're meeting with several people, you want to make sure you're in a space where all those people have a space to sit. You don't want people to feel crowded or have one person that has to stand where they might then feel less important. If somebody has to stand, it should be you. That being said, you should avoid having to stand also, because then it can just physically come across as if you're looking down at the client when you want to try to make sure you're at eye level with the client whenever possible. So you want to make sure you identify yourself to each family member or member of the focal system. So again, if you're meeting with a group of people, go take the time, introduce yourself to each one of them. Hi Maria, I'm Caitlin. Hi Josh, I'm Caitlin. You want to make sure that you're sending the message that each of them has an important and valued voice, as opposed to only paying attention or directing your communication towards whoever is the head of the household or the head of the focal system. You want to use their names, because this lets them know that they're important and you know who they are. You want to make sure your cell phone is on silent. Please make sure you do that before you go into a meeting. Request a meeting area that's comfortable for all parties. So again, like making sure everybody has a place to sit, and take the client's lead and use your best judgment. So if the client wants to sit in the living room, just pay attention to that. You want to, especially if you're in their home, you want to follow their lead, but you also want to make sure that you are in a safe place, and you want to try to limit distractions. So you might ask the client, if you feel that the space is not appropriate to accommodate everybody that should be part of the meeting, then you should ask the client if there's another option, because there might be, but there also might not be, and so you want to make sure you ask, but in a respectful way. You want to think about how you might handle an interruption, and you want to think about how you would handle the client offering you a beverage or a snack. So this is kind of always things that you want to try to avoid interruptions. You want to usually not accept certain gifts or things that are offered to you, but you always want to use your best judgment. Relationship building. So this is where you have the opportunity to use your active listening skills. You're going to reflect feelings and content. These are things that you learned about in your 103 class, and which was your interviewing class, and you practice these things there. We practiced them also in 201 at the beginning of this year, but summarize content, reflect feeling, use your verbal and nonverbal communicators like eye contact and solar and minimal encouragers like go on, I see, open questions, closed questions. You want to withhold judgment. And again, the first step to withholding judgment is being aware of your judgments. You want to ally with parties even if they're not present. So in other words, if you were meeting with an entire family and or you were supposed to maybe meet with a family and you're speaking to the mother, and the mother's talking about her daughter, and the daughter says, the daughter's name is Nora, right? And she says, well, Nora doesn't want to be bothered. You want to reflect that. You might say, Nora doesn't feel her help is the answer, instead of Nora doesn't want to help, or Nora must not care for her grandmother. So what you don't want to do is demonize Nora or make it seem like Nora is the problem, especially if she's not there. Well, whether she's there or not, right? If you haven't met Nora and this is the first time you're meeting with the family, you don't want to assume that it's all on this one person, and you don't want to reinforce that idea to the person who's presenting it to you. So you want to reflect feelings and content. You want to be careful that you are able to do so as objectively as possible and not taking sides. I hope that makes sense. Again, if you have questions about this, please post on the Q&A forum or send me an email. Or we can also bring this up in your 201 class and talk about it there. And you want to make sure you're being genuine, right? So people connect more with people who they feel like are human. And when I say human, you want to present yourself as professional, right? Like if I just got Taco Bell on my shirt, I'm going to try to clean myself up before I get there. You know, everybody's human. We all get stained sometimes, but you want to still be professional. But what it means by being genuine is about being yourself. Not oversharing, but also not acting like you are up on a pedestal, like you are more important than the client, or you're, you know, a fancy expert. You want to be humble. You want to be aware of your position, and you want to be aware of the fact that the client is vulnerable and asking for help, and you want to be empathic. So my question here is, what's the difference between being genuine and using self-disclosure? And I just want to remind everyone that you can be yourself without sharing too many personal details about your life, right? Being yourself means sharing your personality, and in a professional way. So again, if part of your personality is that you tend to be very sarcastic, you will probably want to avoid that at least in the beginning stages of client engagement. But you want to be kind, you want to be empathic, you want to be a good listener, and you want to care about the client. And hopefully those are genuine characteristics that you have as a social worker, but you don't want to overshare. Okay, considering client rights is a really important way to make sure that you're entering into a collaborative relationship, right? So all clients have the right to be treated with dignity and respect. All clients have the right to privacy through confidentiality. All clients have the right to participate as collaborative partners in the change process. So you shouldn't be setting the agenda for them, right? Even if they're mandated clients, it's still their life. So you want to look at what you're going to work on together. You want to allow the client to set goals that make sense for them, that are reasonable for them, and you want to set objectives that are going to work for them. But they should be collaborative partners. They shouldn't be just being ordered around or told what to do. They have the right to receive culturally sensitive treatment. They have the right to have an equitable share of societal resources. So what does this mean? It means access to services. It means being able to have an education, which, I mean, we all do, but not all things are equal. Okay, so they should have equitable share of societal resources. So everyone has access to an education, but that's not equal access isn't always equitable access. So for instance, some school districts give out tablets to every kid in the school for them to do their homework on, and other school districts can barely even afford books, never mind tablets. So in terms of this client right, it's to make sure that we are trying to kind of even the playing field to the best of our ability in order to help clients meet their needs. To view challenges from their own perspective. So this is about empathy. It's about meeting the client where they're at. It's about not imposing our own judgments. The clients have a right to participate in gathering and analyzing information, so they should know what's being said about them. You may have to write reports. You may be reading reports. Those reports are written by social workers or other professionals, they're not written by the client themselves. So the client should know where the information is coming from, and be willing, be part of the information gathering process. Clients have the right to set their own goals. Sometimes there might be program goals that you have to meet. So for instance, if you met the client in a homeless shelter, one of your goals is probably going to be to find the client housing. Client may have additional goals besides that, and they have the right to set those goals. You do also want to meet the goals of the program, so those things work together. And if the client does not want to meet the goals of the program, then they have the right to go to a different program. The clients have the right to resist what the workers want. So if you're trying to tell a client what they should be working on, they have the right to say, no, this is what I want to work on. They have the right to choose among various interventions, so you should give them options for how to achieve their goals. If someone is coming to you for therapy, you might say, do you want client-centered therapy, or do you want cognitive behavioral therapy, right? And they can choose a therapist that best fits their needs. The client has the right to negotiate the distribution of roles and responsibilities for themselves and the worker. So you should discuss with the client what you are going to be responsible for and what the client is going to be responsible for. They have the right to collaborate on the evaluation process. So again, it's gathering information from the client. When you're doing an evaluation, it's not imposing all of your judgments on the client. And they have the right to help determine timeframes and no costs involved. So you should not send the client a bill at the end of your services without discussing that with them up front. And they should be aware of what the expected time frame is and have some say in how that's approached. Okay, sometimes you're going to experience roadblocks, right? So in other words, a roadblock might be a time that a client shuts down. And so a lot of times that'll happen because clients often feel powerless. It's very common for someone to feel vulnerable when they're in the position of asking for help. And when you feel vulnerable and when you have to ask for help, it's usually because you can't resolve the problem on your own, and that results in people feeling powerless. And it can be very, very difficult to ask for help, and sometimes this can present as a roadblock, otherwise known as resistance. You may have heard of a resistant client. So it might feel like people are not forthcoming with information, and that could be because of those feelings of powerlessness and vulnerability. And it could also be about their past experiences of being in a helping relationship. Maybe they didn't get the help they needed. You want to acknowledge the client's feelings. You want to ask them about their previous experiences with social workers or with asking for help or other agencies that they've been a part of. When I was doing clinical work, one of the first questions I would usually ask someone is, have you ever been in counseling before? I want to know what that experience was like for them, because it's gonna give me some insight, and it's gonna validate their previous experiences. We want to reframe when possible to highlight client strengths. So this is a good way to get through a roadblock, is to try to find another way of looking at a problem. So for instance, if a client is telling you that they feel really trapped and overwhelmed, you might say something like, I'm amazed at how well you're doing considering these circumstances. I feel like most people wouldn't be able to do as well as you have done. That's called reframing. So it's looking at what a client has already overcome. Many clients are experiencing multiple problems when they're coming to you for help. And in some ways they have been overcoming, or at least maintaining some level of functioning before this point. So you want to acknowledge those things. Ask the client if there's something they're experiencing that is not being addressed, or if there's something happening that is making them uncomfortable. So if you've been working with somebody and they're kind of shutting down, or if it's the first time you're meeting with somebody and they're just not opening up to you, you might acknowledge the feelings by saying, like, I know that it feels strange to have to share so much information with somebody who's a stranger to you. Or you can ask them, are we covering the things that are important to you? Are we addressing the things that you came here for today? Is something happening that's making you uncomfortable? Am I doing something that you're not comfortable with? Acknowledge those things and ask people what's happening if they're shutting down. and address the feelings of mandated clients. So if you do have somebody that's been mandated for services, you want to acknowledge that that's frustrating. Those clients are usually going to feel especially powerless. And you want to acknowledge that I know that it must be really frustrating to have to be here. And I'm hoping that we can find a way to work together to make the best of it. You know, we have this many sessions that you need to meet. What can we do? What would you like to work on during that time that's going to make this experience as useful for you as possible? And obviously while also meeting the needs of the program. Confidentiality. There's two types of confidentiality. There's absolute confidentiality and relative confidentiality. Absolute confidentiality is pretty rare. What that means is like you're basically saying something to a locked box, right? Like if you tell me something, it's not going to go anywhere outside of my brain. This is rare because most of the time we are writing notes about what the client said. Very often we're engaging in a supervision process where we're sharing with our supervisor what's happening with the client, or we might be meeting with a team of people where we're talking about what's happening with the client, or we might be writing reports on the client that are going to go to a judge or to another agency. So when those things, which are much more common, when that's the case, what you're engaging in is relative confidentiality, meaning that you are only going to share the information that you have to share and only with the parties that you have to share it with. And you want to make sure that clients are really informed about what confidentiality means. So for instance, there's always some limitations to confidentiality. So I worked with kids for most of my life, and what I would start with is by saying everything you tell me is confidential, meaning that what you say to me is going to stay with me. There are a few exceptions to that. If you tell me that somebody is hurting you, I am mandated to report that. If you tell me you want to hurt somebody else, then I am going to be mandated to try to take action to make sure that doesn't happen and to get you the help that you need to prevent that from happening. If you tell me that you want to hurt yourself, I'm responsible for reporting that to try to take measures to make sure that that doesn't happen. I also might share certain information with my supervisor or with other members of the treatment team. And most of the time when that's going to happen, I will let you know what type of information I'm going to share. Usually I'm going to talk about how well you're doing, if you're coming consistently to the appointments that we've made, and if I feel like you're making progress towards your goals. If there's something specific that I feel I need to share, I will address that with you first and let you know what I'm going to share and why I'm going to share it. So that's usually how you obtain informed consent. Very often, clients will have to sign consent forms when they come for services or treatment or whatever the case may be. And then privileged communication means that there might be some instances where, if you have privileged communication, it means that it's going to be kept confidential. And in some instances, in a social work setting, this is the case. But so if you think about like doctor-patient privilege or lawyer-client privilege, so you don't have to share that information with anybody else. Most often, communication that happens between a social worker and their client is privileged, meaning that it can't be obtained through subpoena. Progress notes, on the other hand, usually can be. So this is why it's really important to make sure you understand what your protections are, what your client's protections are in terms of your agency policies. The NASW, which is the National Association of Social Workers, they have lawyers on staff that you could call if you had a question about whether or not you have to share information, if you received a subpoena about a client. So if you if a judge was asking you to share information about a client, and if the client is mandated by a court of law to receive services, most often the judge is going to want reports on those services, or a probation officer or something like that. So it's important to understand who has access to the information that your client shares with you. Again, any questions, please post on the Q&A forum. Okay, we're now entering into the next chapter, which really talks about communication. this is stuff that you have learned before in your interviewing class, and this is just a slightly different way of looking at it. So we're looking at, we want to remember the importance of verbal and nonverbal communication. And over here, this image is from your textbook. So we have the sender, we have the messages that the sender is trying to send. So the thoughts and feelings and words that you're putting now in action. So when we send a message to someone verbally, the person who hears us talk is the receiver. They have to decode the message. They are interpreting the message based on perception of meaning. So they're perceiving what you have said. They're then responding based on their perception, right? You're going to decode what they said, and you are going to respond based on your perception of what they said. So this is called the dialogue information loop. So we are not only responding to what the client's actual words are, we're responding based on our perception of the client. Okay, and they're responding based on their perception of us. This is one of the reasons that it's so important to make sure that we're culturally aware, that we are treating clients with dignity and respect, and that we're considering the client's systems and the client's previous experiences and asking about those things, because we want to try not to trigger a client. We want to use words and phrases that the client understands. We want to avoid technical jargon or expensive words, right? So another way of saying technical jargon too, like we love to use acronyms in social work, right? So some really common ones are CPS, NASW, DSS, right? Most of the time clients are going to know CPS, DSS, but then there's lots of other ones. Like my previous agency was funded through OCFS, which is the Office of Children and Family Services, but most people don't know what OCFS is. Many different programs have many different acronyms, and I'm sure you've heard many of them in the field already. It's important to be aware of that. We get comfortable using them when they're familiar to us. It's important to be aware that the client might not know what those things mean. And even if you go to a different agency, the people that you're talking to there might not know what they mean, because acronyms are so overused that they may mean different things in different places. And you want to make sure that you're careful about how you communicate with the client so that they understand what you're saying. Okay, we want to respond proactively. Proactive responses are responses that articulate the current situation and its impact from the client's perspective. So making sure we understand what the client is saying. In your interviewing class, you probably talked about this as summarizing, right? So you're kind of repeating what the client said back to them, using your own words to make sure you're on the same page. You want to make sure your responses, you want to give responses to define a positive outcome to direct the work. So you want to ensure that you are responding in a way that shows that you are hopeful that a solution can be found, that the goals can be achieved, and that you're going to be able to work effectively with this client. Proactive responses are also responses to identify strengths and resources available for goal achievement. So I understand what the problem is. We can work together to address these issues, and these are some of the strengths and resources that we have available to try to get us there. So these are the steps to get us there, right? This is a way of painting a hopeful picture. We want to be empathic. We don't want to minimize the client's concerns. We want to reflect their concerns and the seriousness of those concerns. We want to reflect and validate their feelings, but then we also want to frame it. We want to frame the direction in a way that we know that we can have a positive outcome. There is a video on YouTube about saying you failed the course versus you haven't met the course objectives yet, right? So you haven't moved on to the next level yet. Saying not yet kind of implies that you're going to get there, right? Versus saying failed, which just sounds very terminal, like you're done, you have no shot, it's over. And you want to make sure you're approaching things from a yet perspective. So we're not there yet, but this is how we're going to get there. And language is important here. So exactly like saying not yet versus failure. What's the difference between a challenge and a problem? I think we talked about this a couple of modules ago, but a challenge is something that can be overcome. It can be exciting even. And a problem is something that sounds very negative and overwhelming, and we can get trapped underneath them. So making sure that we're using that kind of proactive language is important in our responding to clients. When we're articulating the situation, we want to make sure we're, again, these are the questions we want to ask. What is happening from the client's point of view? That means acknowledging our own worldview and putting our judgments aside to understand where the client is coming from. What other associated events might be related to this? Who are the other people involved or affected by the current situation? What is the impact the events are having on the client's life? And how is the client making sense out of what's happening? This is how we articulate the situation. We want to make sure we understand what's happening from the client's point of view, who is involved in this, what are all of the factors that are contributing to this. And we're going to learn how to do this more specifically when we get into assessment in a couple of weeks. And we want to make sure we define a positive direction. So once we've articulated the problem, how would the client like for things to be instead, right? So what are we hoping to achieve? This is not an ideal situation that we're in right now. What would we like our lives to look like? What would it look like if things were working in that way? What are the indicators that would signal that things are beginning to improve? So change usually happens incrementally. Sometimes it happens all at once, but very often it's a little bit at a time. So how can we tell that it's getting better or that it's gotten better? So if we are currently homeless, we want to have a home. We would know that we had a place to put our head down every night, and the indicator would be that we were approved for Section 8, right? Something along those lines. But you want to define a positive direction. So from the client's perspective, what do you want for things to look like? How do you want things to be? And how do we know when that's happened? We want to make sure we're identifying strengths and resources. So can you think of a time in the past when things were working the way you wanted them to? So obviously, when you're thinking of something like housing, which is pretty concrete, how were you able to afford your bills in the past? Like what was happening that was helping you maintain that at that time? Times currently when things are working best or even a little bit better than usual. So maybe we're looking at a different kind of a problem. Maybe we're talking to a client who's experiencing depression. Can you think of a time in the past when you weren't feeling depressed? Can you think of days like that maybe you're feeling less depressed or that it's a little bit easier to get out of bed? What's happening during those times? What do you see as your personal strengths? And how are they related? How can we use those things to meet our goals? What's available in the environment that could be a resource? So how can you achieve your goals? What do we have available to us? Other people who might contribute to the effort and what they could do. So maybe your mom could help you get out of bed in the morning. Like maybe she can, but that's something you have to be open to, right? So making sure that we're looking at what the resources are, but also what the client is open to. Maybe the client says, no, I don't want my mom to help me. What coping methods have you used in the past to manage the situation? What coping methods are you using currently to manage the situation? And what are your ideas about what others do in a similar situation? How do you think other people manage their depression? That might be a way of developing an understanding of what the client views as coping mechanisms. What are the other influences on communication? These are things that we need to consider. Culture, assumptions, expectations, emotions, distractions. We're talking about engagement and forming a relationship with a client, right? So it's really important that we understand what is impacting our ability to connect with that client. And sometimes there's cultural things that might have an impact, whether we identify as part of the same culture or as part of a different culture. Culture can have an impact on how we connect to a client. Our assumptions about the client, our client's assumptions about us, our expectations about what the helping relationship is going to look like, and the client's expectations about what the helping relationship is going to look like. The client's emotions, we should hopefully be emotionally competent during our meetings with the client, but the client's emotions, clearly, if a client is very upset and tearful, or if a client is very angry, those things are going to have an impact on how you communicate with the client and how the client understands how you're being received. Remember, when we get angry, we get stupid, right? So it's not only about what we say, but how we say it, being mindful of our facial expression, being mindful of our tone of voice, and the choices in our language. And then distractions. So is my phone going off? Is the client's phone going off? Is somebody coming in and out of the room? This picture is obviously a little bit dated. It's got the little AIM guy up here. I don't think he's really relevant anymore, and I do not see Snapchat. But we're constantly being inundated with distractions. We're constantly being impacted by our macro system, like the media and the way that we believe the world is viewing us, the way we believe we're perceived by the world, the messages we're receiving about values and things like that. So it's important to be aware of these things when we're developing a relationship with a client, and considering maybe if we've hit a roadblock, where are those roadblocks coming from? Okay, responding to clients' words. So this is directly from the text, and they gave, I like this, I like visual cues. So they talked about responses going from the least directive to the most directive. So the least directive is allowing space, right? So silence. A client says something, or maybe you've asked a question to a client. You need to give them time to answer it, or sometimes a client says something and you need to give them some time to think about what the next thing they're going to say is. And that's the least directive. It's just sitting with the client and allowing them to have some space. Nonverbal responses, so a head nod, right? Eye contact. Those are our nonverbal responses. Single word responses, yes, I see. Restatement. So it sounds like that really has been bothering you. Making sure you're hearing the client clearly. Clarification. So let me make sure I have this right. It sounds like you were really upset when this happened. Summary clarification. So this is more not after a specific statement, but maybe after the client has been talking for a few minutes. Okay, so you've told me a lot in the past 10 minutes, and I just want to make sure that I have everything clear. And then going through in your own words what the client says so that you can make sure you're on the same page. A request to continue. So go on, tell me more, right? That's directive. You're asking the client to continue talking. And then questioning is the most directive. So asking direct questions is going to require a client to respond. So that's considered a directive response. Again, questions please post. Responding to clients' feelings. There's lots of ways that we communicate with clients. There's verbal, nonverbal, there is content, and there's feelings. So we want to respond to feelings whenever we can, and in order to do that, we have to observe for feelings in verbal and nonverbal expression. We want to tentatively identify the feeling in words. So it sounds like you're really angry, or it sounds like you're really embarrassed. If you're wrong, if the client says, no, I'm not embarrassed, I'm pissed off, that's okay, because you've gotten them to identify the feeling themselves, and now it's on the table, right? So you want to say what you're hearing, but you want to ask them a question, right? So it sounds like you're feeling really embarrassed. You want to connect the feeling expressed to the associated events or thoughts. So it sounds like you got angry when he yelled at you. This can be a really, really powerful thing because it really can help the client start to see patterns of behavior. It can help the client understand the part that they played in whatever is happening. And that's something that can help a client feel empowered, is understanding their role. Step 4 is reflect the feeling to the client verbally using some variation of the formula. It seems that you are feeling angry when you talk about Sarah. Sorry, Sarah. Step 5, wait for the client's response to agree or disagree with the reflection. Step 6, if the client agrees, accept and validate the feeling. If the client disagrees, go through the steps and try again. And again, sometimes the client will disagree and name the feeling themselves. Remember that feelings are always correct, and You don't have to approve of their feelings. You don't have to disapprove of their feelings. You should avoid saying you shouldn't feel angry about that, or that's nothing to get upset over, right? Because that's dismissive, and we want to make sure we're validating our clients' feelings. Everybody has the right to feel what they're feeling. But by reflecting the feelings, we can help people really gain some insight about what they're feeling and how it connects to the behavior or the person or the event. And that can help them start to take ownership and figure out, what do we do next?